Hi everyone, my name is Erin Chakiris. I'm here today to talk to you about a career in medical assisting. Medical assistants are an important asset to the medical office because they provide support to front staff, providers, and patients, all while maintaining a smooth flow of the medical office. The job description of a medical assistant is that they work directly with patients, providers, in both outpatient and inpatient facilities such as doctors' offices, emergency rooms, and walk-in care centers. Medical assisting is one of the most growing careers in the U.S. They perform both administrative and clinical duties such as computer work, scheduling appointments, arranging outpatient testing for patients, and prior auths. To become a medical assistant, there are two routes you could take. There is a associates in medical assisting, which requires minimal prerequisites to get towards your medical assisting diploma. When you graduate, it's about a 1.5-year program. You'll have an associates in medical assisting, and you will be required to take the American Association of Medical Assisting test. It is good for 5 years. You have to maintain your credentials by accumulating a certain number of CEUs per year over the course of 5 years. Once it's expired, you're required to either retest, or as long as you have 60 CEUs, you're able to continue with your medical assistant certificate. Another way to obtain your medical assisting certificate is to go to a trade school, which is where I had gone. It's Ridley Lowell Business and Technical Institute. It was about a 1-year program. I did basic math, anatomy and physiology, some chemistry, English, writing, computer. After you were done with all those, prerequisitions, you were required to do clinical competencies in an outpatient facility. You had to apply to anywhere you wanted to perform, and based on your performance there, they would either pass or fail you, and if you are lucky, you would get hired from your externship, which is what I did. I did my clinical competencies in a cardiology office, and I got hired right from there, and I was very happy. I landed a position, starting wage about $16 an hour. This was 5 years ago, and I really liked it. I worked for a reputable company. It was Lawrence Memorial Medical Group, and now we're a Yale New Haven Hospital affiliate. Some of the duties that I'm required as far as administrative, I do fill in at the front desk sometimes, answering phones, scheduling appointments, booking outpatient procedures, mammograms, bone densities, cardiac echoes, anything radiology. I do book surgeries as well. So there's two ends. So the administrative staff, I actually enjoy. The clinical role of the office is nice as well. It's great to be able to have a balance with both of them. So for clinical duties, it's, vitals, blood pressure, height, weight, venipuncture, assisting with procedures, assisting the provider with procedures, injections, depending on the state that you live in. I'm on the border of Connecticut and Rhode Island, so when I work in the Rhode Island office, I'm responsible for all immunizations for the office. In Connecticut, they have a nurse. So another portion of the administrative duties would be, maintaining the flow of the office. So you want to make sure that when you're at work for the day, you have this many patients and this many charts need to be organized. That's called chart prep. I do it the night before. I look to see what they're due for, what they're coming in for, make sure everything is ready for the provider. If there's an order that needs to be done, I have it ready ahead of time for them, so that way they can maintain the flow of the patients, see 15, 20 patients a day in a 20-minute increment, and not get behind. In addition, to that, I do some triage. I educate the patients on, I work in an OB/GYN office, so I educate the patients on STD prophylactics, birth control options, safe sex, anything that the providers would like addressed with the patient before they come in the room to have hands-on one-on-one with them. They're trying to save as much time as possible. I enjoy my career as a medical assistant, and I think that most people do. It's very rewarding. It's an entry level career towards medical, and I wouldn't change it at all. I really am happy with where I am. It's provided so much education for me, and I feel that I'm better prepared to use my skills in the long run. The basic idea here is that without the staff of medical assistants in an office, they wouldn't be able to maintain a flow. Medical assistants are the backbone of the office. We're always there to make sure the entire office is supported, everything's done accurately, efficiently, and without us, it just wouldn't work. So if you're ever considering a career in medical assisting, I would highly advise it. I would have changed taking the associate's route, though the certificate, I mean, if you were to transfer any of those certificate credits to any school, they would not take them. So keep that in mind. And again, medical assistants are the backbone for the medical office. Thank you for your time.